questions. And then put it like Kyle's forums available on the central line so folks can watch it too at a later date. But just so you know, it's being recorded.
So no heckling?
You can heckle me. Don't heckle Prairie.
I mean, I thought I just
I'm a big girl.
I
mean, everyone's asking that question, so I thought I just wrote
Right, yes. I'll be sitting back here.
Okay.
So, yeah. But thanks, Con.
And did you want to turn off that light? Is that? No, thanks, Abby. Can everyone hear me okay? Okay, my name is Karen, and I work for a company called Planetree. Does anyone know who Planetree is as an organization? Kind of heard rumblings of the word around the facility a little bit. Well, good thing, because I'm here to kind of talk to you about who Planetree is today. And I'm here to answer your questions. Your organization has chosen to work with Planetree and partner with Planetree to really help you continue to develop your person-centered culture that you have going throughout this organization. And that's really what we do as an organization. But we'll go into greater depth than that over that in just a few minutes. So again, thank you all for coming this morning. Come in and sit down if you'd like. So one thing we know in working with healthcare organizations is, all of us have chosen to work in healthcare, and so we are all patient-centered to some degree. We all have kind of some concepts of what patient-centered care means to all of us. But one thing Planetree really tries to do with organizations is to help them systematize that patient-centered care or systematize that person-centered approach, so that it isn't a lot of individuals who are working in patient-centered care or doing some of their own individual focus on patient-centered care. It's how do we as a system become really all moving forward in the same direction and a full system that's embracing a person-centered culture moving forward. And we know that the principles of person-centered care apply across the continuum of care. So whether in long-term care or acute care settings or critical access hospitals or ambulatory surgery centers or freestanding cancer centers, any of those healthcare organizations across the continuum, we know those principles of person-centered care really apply to all those. We also know that those principles hold true around the world. Planetree works in 25 different countries with over 800 healthcare organizations. And it doesn't matter if I'm in Australia or in Saudi Arabia or in Qatar or in Brazil or in Canada or in Fergus Falls, Minnesota. It all seems to be that those principles really hold true. We all want to provide care or receive care in a compassionate and caring environment, really in partnerships with our patients and families. So we're really creating those true partner healthcare experiences for everyone. Does that make sense? So the word Planetree, kind of a funny name. Anyone know what a plane tree is? Every once in a while I find somebody who knows what it is. We get everything, I answer the phone and someone says, is this Planetree? Or I get written materials or emails and they've separated it from why should it be, so it's plane and tree with capital T. And it's like, no, isn't that either. So a plane tree is a sycamore tree, just another name for a sycamore tree. Has anyone ever seen a sycamore tree or you know the sycamore tree? Big, beautiful, overarching umbrella, really beautiful trees. And Hippocrates taught his first medical students under a sycamore tree. And so, he was teaching those concepts of do no harm and holistic healing and really treating that whole person. And so when our founder determined that she was starting this company, she really felt like that was a real representative of what she was trying to portray with her company. So she chose the name Planetree. So the company was actually started by a patient 40 years ago. And this was a woman, her name was Angie. She was visiting the United States, got very, very ill, was hospitalized for quite a period of time and had a very complicated diagnosis. And she is still alive today. I actually met her last year. And she will tell you that she received some of the best technical medical care possible. She was cured, she was healed, all of that, the outcomes were great. But she will tell you that that experience of being a patient really left a lot to be desired. We have lots of chairs up here, please feel free to come on up. So that experience just was really lacking things like the information she needed about her diagnosis. Again, it was really complicated, but even when she would ask questions like, help me understand what's going on, she would get, just the, it's okay, dear, we'll just take care of you, you just lay there and get better. Really not including her in a lot of those conversations. Even to the point where clinicians would be on either side of her bed. 40 years ago with those paper medical records, it was becoming a thick chart, and because they were trying to talk to each other over her, opened the medical record right on her chest and were leafing through it so they could collaborate over it, and that was a convenient spot. But again, not including her in those conversations. So she was visiting a foreign country. She was scared. Her husband was there, but when she wanted or needed him there, visiting hours were over. He couldn't be there with her. So here she was, alone and afraid, didn't know what was going on with her, could not have her family member there with her. And then we put things in people in things that look like this. You never see a hospital gown, or anyone have the luxury of having worn one before. So we have this, just scared, in pain, uncomfortable, we're sick, we're lying in a strange bed, we can't have our family members with us, we don't have enough information, and then we have no privacy or dignity or any of that because we're put in apparel, that glamorous apparel like that. So she really felt like when we have this world class healthcare, why can't that patient experience align with that? Why can't we have world-class patient experience as well? So she started the company, and like I said, that was 40 years ago, and we now work in 25 different countries across the continuum of care with over 800 healthcare organizations. And really with the goal of continuing to drive quality. And we know in healthcare, we've got to have quality. We've got to have quality healthcare. That's kind of what we're all about. But it's more than that. It's more about like that quality of life. How do we improve that quality of life for the patients and families who are receiving care in our facilities, and that quality of life for the staff members who are providing the care? Because what would happen if that quality of life for the staff members is not all that great? What would happen if it wasn't all that great to work where you work? What do you think that patient experience would be like? Not great. Yeah. You think they kind of tie together? They absolutely do. We know that if there aren't happy staff members, it's pretty hard to have a lot of happy experiences for patients and families. So how do you bring all of that together and create good healthcare experiences for all? And a lot of times when we come in and start speaking to organizations and we ask, what is patient-centered care and what do you think about patient-centered care? We hear lots of really glorious kind of flowery things, like, oh, that means, you paint the walls a really pretty color, and it means that the patient's always right. That's not always the case either. People talk about, having, the scent of aromatherapy, lavender aromatherapy wafting through the halls.
May I have your attention, please? Planetree engagement sessions will be held today in conference rooms A and B
You have overhead
at
painting.
10:30, 12:30, 2 o'clock, 3:30, and 5 o'clock.
And things like aquariums in the lobbies and just all those flowery things that then it's like, oh yeah, it's all that kind of fluffy stuff. But a few years back, Planetree actually worked with the National Academy of Medicine and co-authored a discussion paper that really began to look at the evidence base to support patient and family engagement. And they really found, and this discussion paper is available on the internet, you can download it and read it all you'd like. There's a huge bibliography that really brought together the evidence that demonstrates that when you really do create a true and authentic person-centered culture, engaging patients and family members as active participants in their healthcare experience, you do have better outcomes. So feel free to go online and look at that, but the evidence is definitely there that says that it's worth putting some time and effort into that. And coming out of that, Planetree has restructured their certification for excellence in person-centered care and the framework that we use in working with healthcare organizations that really demonstrates that if these criteria and this framework is actively put together and implemented throughout an organization, that you really can say that you've really created a true and authentic person-centered culture. It's even recognized by the Joint Commission as a quality check, that even the Joint Commission says that when this framework is implemented effectively, that you really do have an engaged person-centered culture. And I am not going to go through all 26 criteria. They're very detailed. This is available online though. You're certainly welcome to, if you'd like to learn more about it, you can go online and you can download the criteria. But we are just going to touch on the 5 drivers, that kind of umbrella that is overarching above those 26 criteria. And again, please feel free to ask questions if you have them, because I'm here to answer your questions. So the 5 drivers are creating organizational structures that promote engagement, connecting values, strategies, and actions, implementing practices that promote partnership, knowing what matters, and using evidence to drive improvement. So to break those down just a little bit, the creating organizational structures that promote engagement is really that foundation. We know that when we're beginning to build a true and authentic person-centered culture, there need to be some foundational elements in place to really build off of. No different than like building a house. You got to have that solid foundation and really put everything in place before you can begin building upon that. And a lot of those is how do we look at truly co-designing work. So getting the voices of our patients, or of our staff members, the staff at all levels. So it isn't necessarily about leadership deciding, we're going to move forward, we're going to do something, and all of you just need to kind of come along. It's really looking at things in a different way. How do we get the voices of the people who are actually, that front line? All of you are doing work in your areas, sometimes with patients and family members, sometimes with your colleagues. However your work, you're kind of that front line, that first point of engagement. And how are we getting your voices to really, if we're going to be improving practices or improving processes or really improving your work areas, how are we getting your voices in that and really helping you to be part of that? And so one thing that we encourage organizations to do is put together like a steering team or a guiding team that really oversees a lot of the person-centered practices that you maybe already have some of those in place and that you're going to be building on, but getting the voices of stakeholders at all levels. So staff at all levels, it's interdisciplinary, so from across the organization, and it's not an executive leadership kind of team altogether. There may be a leader or two on, but really staff all throughout the hospital. So when you're creating and doing different things throughout the organization, really getting the voices of the people who are truly impacted by those decisions. And then finding ways to really partner with your patients and getting your patients' voices. We know that patients, when they come into an organization, into a healthcare experience, whether they're lying in the beds or in a clinic office or sitting in our waiting rooms or eating in our cafeteria or any of those things, they see things through a completely different lens. It's the same thing with all of you. Like I said in the first part, is that you working in your departments see things through a different lens than leadership who is in the administration wing and seeing things from that perspective. So it's important to get all of those perspectives together when you're really trying to make and improve and enhance your culture. And when you really do get all of the right voices in the room, you really begin to change from that institutional thinking approach. So it isn't, again, just that directive from leadership. Everyone is working together toward the same goals, and we're actively listening to each other and getting the right voices. So it changes things from kind of this top-down leadership approach where leadership makes decisions and just drives them all the way down to throughout the organization, to really more of a bottom-up leadership approach, so that you're hearing from the staff members at all levels. We know that there are leaders all across the organization at all levels of an organization and in all departments. So how are we tapping into that expertise and really bringing those thoughts to life? And then again, human resources systems. We know in a hospital, in almost any industry, the human resources are some of the most robust and the most important resources we have in our organizations. So how are we really creating those foundational elements through our human resources systems? So once we have really developed and created a true and authentic person-centered culture where we really have created that compassionate and caring work structure and all of those kinds of things, and we know what it's like to work here at Lake Region. We do things differently here. And you need to potentially hire new people in because you have some job openings. How do you know that you're hiring the right people who really fit within your culture? So do you have like the appropriate behavior standards and set expectations in the beginning through job descriptions or even in advertisements and then even into the interview process? Are some of you even invited potentially if there's an opening in your department and they're hiring to fill someone who's going to either be sitting side by side with you or working next to you or working in that area? Are you invited to be part of some of those final interview processes so that you can help decide who you're going to be working next to? We even encourage, and we know many organizations that invite patients to be part of those final interview stages. In long-term care, frequently there are resident panels because that's their home. And they will be part of those final interview processes because if you're going to come work in my home, I should have the ability to interview you. And so really looking at how can we partner so that we're getting the right people working in the right places in our organizations that really fit in with the culture that we're trying to create. And once we get those people in, are we orienting them well so that they know that this is the kind of culture we've created here? Are we giving them the right tools and education and enhancing their skills so that they can, we all can be developed together and we can all work toward the same goals? Do we have the right behavior standards and things within our performance review process so that we can hold each other accountable to continue to maintain that culture that we're trying to create in our organization? And then at times when people leave, you know, if maybe we haven't done things right, you know, we're human, we don't always hit the mark, and somebody chooses to leave the organization and go somewhere else. Are we talking to them and finding out, is it something that we're just not doing right? Is it something that we could be doing better? Because if we're going to spend the time and effort to hire the right people and get them on board and train them and go through all of that, we don't want them to leave. If these are good people, we want them to stay. So how do we learn from those processes? Again, human resources is a really strong foundational element. And then looking at our environments. Do we really provide environments that are that have either real or perceived barriers to engagement removed? A lot of times I'm going to organizations and do tours, and whether it's a clinic office or sometimes a business office or even sometimes in the emergency department, I'll go in and I'll see like those plexiglass screens that you know, above the registration desk. So I know there's a person behind there, but if I'm the patient coming up to talk to somebody, I have to knock on a window to get through or yell through the screen, or sometimes that doesn't even move. Sometimes they can slide it. Sometimes there's just a little hole or can pass papers through. So I've got to kind of lean down and yell through the hole. And when I ask people about that, they're like, oh yeah, it's a HIPAA violation. We can't take that screen down. So me standing there yelling at you through that window and yelling my health information so the whole waiting room can hear, I'm wondering, you know, where that disconnect is. So we kind of hear that the reasons why we have a lot of these kind of barriers in place, because somebody at some point thought that that was going to be protective of HIPAA, or it's an infection control procedure. I hear that one all the time too, it's infection control procedure. We're handing papers back and forth. I'm leaning down and I'm yelling through that, so I'm probably kind of spitting through there too. So I'm thinking maybe not so much, I don't know. But how are we removing some of those barriers to engagement? How are we really creating inviting spaces? It's even like waiting rooms frequently. Frequently I'll go into waiting rooms and just see chairs lined up like this. And so you have family members trying to kind of sit together and maybe have little discussions. Kind of hard in this kind of seating arrangement. And frequently it's just chairs like this. How can we just potentially just move them in a different configuration so that it's just a little more comfortable and really promotes that engagement between patients and families. And then even looking so far as like, do we have like private spaces where the healthcare workers can have private discussions with patients and families, or are they just standing in the hallway and trying to have some really emotional and serious conversations, but there's nowhere private to go? So again, how are we looking at our environment to really promote engagement? Because it's not all about, you know, creating these beautiful and you know, aesthetically pleasing areas, and you may have them, and that's wonderful, but that's not all that helps to promote engagement. Sometimes it's just removing those barriers. The next one is connecting values, strategies, and actions. And what this one really gets to is really, if we say what our values are and we express our mission, and we really believe that that's where we're headed. So, for example, we really, as leaders, want to create this true and authentic person-centered culture. Are our actions really demonstrating the same thing? Are we really walking the talk? So, you know, when we say something but our actions are kind of a disconnect, this one really gets at that. How are we really walking that talk? And if we believe that this is where we're headed, let's have our actions represent that as well. And one of the primary ways we did that is to really look at leadership and leading in a different way. And this isn't necessarily just the C-suite or just the CEO, but leaders kind of at all levels. So it can be managers and supervisors and department directors and all levels of leadership. But really coming and being present for all of you, and really truly and authentically speaking to you on a regular basis and finding out, you know, where are there some challenges where you work? Do you have all of the equipment that you need? Is everything really within easy reach? You know, are things designed well, or could we shift things around a little bit? You know, but really being there for you, because again, you're the ones there on the ground doing the work every day. And so how are we looking at having those kinds of conversations in a different way? Frequently when I go into a healthcare organization and speak to leaders, I hear, you know, we have an open door policy. My door is always open. You can come in at any point in time. My door is open. How many of you have actually walked through that open door? Anyone ever gone up to the CEO and said, you know, I'd like to come in here, have a few things to say? Or any other executive. It doesn't typically happen. There are people who do. We know that there are people that kind of take the time to do that. But I would bet that most of you, when you're here at work, kind of in your departments, doing your work, and you don't turn to your colleague and say, you know what, I'm going to go up to the admin wing and I'm going to go walk through that open door and go chat with whoever's in that door. It just doesn't happen. So again, how do we, you know, as leaders, just begin to lead in a different way? Another thing is when you think of departments that you work together with. I mean, there's lots of departments throughout a healthcare organization, and there are some that you work really closely with every single day. And are those interactions with the other departments always perfect, or might they be able to be fine-tuned a bit? So there's probably a department you can think of right now that it's like, man, we can never get those connections right. You know, we're transferring the patients. They always get mad at us. I just don't even want to call them and let them know I have a patient for them. You know, or any of those things. But what might it look like if on a regular basis, a manager or a supervisor or a department director from that department came to your department, and vice versa, your supervisor went to that department frequently and talked to the people and said, you know what, I know we work really closely together. What's it like to work with our department? What could we do differently so that that's a really smooth transition for both you and for our patients and families? And really began then to work together. Because it really kind of, again, breaks down that siloed thinking. We know we have separate departments, but how do we begin to kind of break those barriers and really all work together as a team? And it really starts with leading in a more intentional and authentic way. And when you do, it really helps people understand that everyone in the organization is a caregiver. It doesn't matter, we know for certain that, you know, the aides and the nurses and the doctors, of course, they're hands-on caregiving every day. That is what they do. But every person in this organization has the potential to impact a patient's day at any point in time. So it doesn't matter if you're the maintenance worker who, like in the middle of the winter, is making sure the sidewalks are clear so that people can get in and out safely, or the housekeeper who is going into the room, you know, to clean the room and interacting with the patient that way. Or think about information systems, for example. What if the internet was down all the time? What do you think your patients and family members would think if they could never get, there's a public Wi-Fi and they could never get on it? So they may never even see the information systems people, but they're impacted by whether or not that Wi-Fi is working. And what about the people who are maybe in the business office and they're printing and sending out bills? What do you think if they didn't get it right, or if those bills weren't easy to read, or when they answered the phone call to talk about a bill, they're like, yeah, you know, I don't answer those questions. No. I mean, think about all of those people. It doesn't matter if you're standing at the bedside actually, you know, putting in an IV. You all have the potential to impact a patient or family member at any point in time. So really making sure that everyone understands that everyone in the organization is a caregiver. And one way that we do that is really working with people and encouraging organizations to do regular experiential education or experiential learning. Has anyone in this room ever done any experiential learning or experiential education? Does anyone know what that is? Awesome, we're going to do some right now. So what I would like you to do, everyone get up and go to the back and get a little cup of water. And do not drink it, just everyone get up and go get a cup of water. And then choose a partner. You need to be in twos. So choose a partner and then come back and sit down next to your partner. Don't drink the water yet, but everyone has to be next to a partner. If there's an odd number, Abby will be your partner. So be sure you're partnered up.
Does everybody have a partner?
There are 3 in this row, so.
There's 5 in this row, so.
Then I guess. Do you guys need an extra person?
We actually, they're
Here. Oh, here.
Oh, there.
Here you go.
Yeah. Everyone have a partner? Okay, here are the rules. No talking at all until I tell you you can. No using your hands to provide direction or any of that. And so the person, you're sitting next to your partner, so the person on the left, as you're sitting there, is going to feed water to the person, to your partner. No talking. Okay, go. No hand movements. No, I mean, well, no pointing or directing. Feed water to the person. No talking. Empty the cup. You can laugh, but that might make it more difficult. And when you're done, switch roles. Go ahead. Everyone done? Cups are empty? Okay. Now I'm going to ask you questions so you can talk now. So, there are a few lessons that we can bring from this. But first of all, when you were receiving the water, what did that feel like?
Out of my control.
Out of your control.
It's okay.
You know, a lot of times, like aides or nurses, kind of, have kind of the hang of this, but then when they're the ones receiving, a whole different story. Usually they're the ones that are delivering. But what did it feel like, other than out of control, to receive the water?
I wanted to tell her how to do it differently.
You wanted to tell her how to do it differently. Yeah.
Like faster, slower.
Yeah. Yeah. What else?
I suppose we're good friends, so.
So you trusted her because you knew who that was.
Yep, no
Yep.
issue. And there wasn't a lot of water in the cup.
So what about when you were the person delivering the water? What did that feel like?
Apprehensive.
Apprehensive? Okay.
Still.
You didn't want to spill.
Didn't know how fast or slow to go.
You didn't know how fast or slow to go.
Had no idea how much was left.
Had no idea how much was left. What about the instructions? I'm standing up here just giving you instructions. What could have been different about the instructions? Or what would have made it different? Were they clear? Did you get all the information you needed?
Did they want it?
Yeah, did they want it? So if we kind of look at some of these things like from different perspectives. So for example, what if I was, an executive leader and I thought, you know what, I'm going to create this new policy and I'm going to have people sitting next to each other and giving each other water. And I'm just going to tell them, you know what, you got to do this. I'm going to write it all up and I'm just going to deliver that. If that really were a policy, did you have enough information? Did you get all the directions? Might there be some additional things that should have been in that written policy? Would it have been better had I come and talked to you and said, you know what, I'm thinking of writing a policy so that the two of you are going to give each other water. I'm thinking it should go this way, like you sit next to each other and then you one at a time do this. Does that work? Or what about if I would have said, this is what I'm doing, and then I ask you, what would make that easier? Maybe you would say, well, if we were standing, that would make it easier. Or if we were like turned facing each other. Or if we were able to talk more, or whatever. But if I asked you to provide input into that practice or that policy, might we have been able to fine-tune those instructions a little better and make it easier to understand? And then what about from the caregiver perspective? So say you're the caregiver and you're the one giving the water. What would have made that easier? What would have made that a better experience? Like someone said.
Having a clear
Having a clear cup, yeah. That might have been something written into the policy, you know, a clear cup so I could even see how much water was there. And someone had said, yes.
I'd want to go back to the beginning and find out why I was having that policy instilled in the first place.
Absolutely.
Were we all thirsty or?
Absolutely. Yeah.
What to do if they don't want to drink their drink?
Well, there you go. What about, okay, so if we're talking about receiving the water, did anyone ever even ask if you wanted water? Or how much water? Or how fast, or how slow? If you wanted hot water, cold water, a big cup, little cup? Any of those things? Did we ask any, what was that? A straw? Absolutely, a straw. How about writing in the policy that if you'd like to, I can just hand you the cup and you can drink it yourself, when and if you want to. But all of those things. So that's really the concept of experiential education, because with some little exercise like a little cup of water and giving it to each other, you can see how throughout an organization you can have a lot of disconnects if you're not asking the right questions and getting the right answers and asking the right people the right questions. And then being able to find out what works and what doesn't work and document and honor those preferences throughout the experience. Does that make sense? And then the other one, along with this, is really capturing stories. And stories don't have to be big, long novels, but we know that in an organization like this, or in any organization for that matter, there are great things happening every single day. All of you are doing great things together with your colleagues. You're doing great things with your patients and your family members. Great things are happening across departments, across the organization. There are really incredible things happening every day. And they don't have to be, I mean, we know we're in healthcare, so we saved a life. Yes, that's a really great thing to happen. But they can be little things, just like, you know, the two of you worked together in a department and you were really struggling with something and she came along and helped you and wow, thank you. That was really helpful. I mean, it can be things that are just that small. But are we taking the time to celebrate those, recognize those, and really understand that, you know what, great things do happen here every single day? Or do we just hear, you know, we got a patient complaint today. What are we going to do about this? And whose fault is it? Because if we only hear about those things, and even if they're once a week, once a month, every few months, if we only hear about the patient complaint, because we are human, even if our goal is every patient every time, we're not going to hit that 100% of the time. Again, we're all human. But if we only hear about the patient complaints, then it begins to feel like no matter how hard I work, no matter how hard I try, we still get those patient complaints. But if you're taking the time on a regular basis to celebrate all those amazing things that you are accomplishing every single day, then when you get those, they don't seem so insurmountable. They seem like, you know what, man, we didn't get it right. We did. We can do better than that. We can do better than that because we know we do better than that every single day. So let's get together and find out what happened, how can we be better than that, solve that, learn from it, so that hopefully we don't repeat that. But it doesn't seem insurmountable if we're celebrating all the great things that are happening every day. So how do we get to that first? And then implementing practices that promote partnership. These are those things that, you know, when Angie started the company, she really felt were really missing in that healthcare experience. Access to her family and loved ones when she really needed them there. Access to all the information so that she could be a partner and make those decisions about her healthcare in collaboration with her healthcare team. Just really getting all of that information. And being included in those conversations, really not only having the information, but being included in conversations. One thing we say at Planetree is nothing about me without me. So if I'm the patient and you're having conversations, whether it's shift exchange or rounds or any of those things, if you're having conversations about me and my healthcare and my diagnosis, then please include me in those conversations. I'm an expert about me. I know about me. And you know about healthcare. So how about we come together and really have those conversations together so we can learn from each other and really have a true partnership. Because we know that if you really include me in those conversations, you empower me to be an active partner in my healthcare. And again, if we go back to those evidence, the evidence in the discussion paper, we know that when I'm an empowered and active member as part of that healthcare team, that I have better outcomes, I get better faster, I stay better longer, and we really have that true healthcare partnership. And a lot of things that need to be recognized in that whole information exchange is the information being provided to me in a way that I truly can understand it. Now, we may speak the same language, or we may not. Maybe I'm visiting and I don't speak English, and now I'm in your hospital. How are you making sure I'm receiving the information in a way I can understand it? Or we may both speak the same language, but I may not speak healthcare. You all speak healthcare, right? And sometimes I don't understand those big words and I don't understand that language. So we might as well be speaking a different language because I don't speak that language. Or maybe I don't read. Do you know if I read or don't read when you hand me the discharge instructions to take home? So how do we get to the place where we can ask the right questions and really understand that the information we're providing is really being received in a way that we want and need it to be? And then knowing what matters. One of the primary things is, we spoke about earlier, is providing care and receiving care in a compassionate and caring environment. And we know that healthcare is really hard. There are days that are really stressful. There's a lot going on. There are life and death situations. It's a challenging career to be in. But we know that we also want to be treated with compassion and caring. We want to treat others with compassion and caring. But these aren't innate skills. We're not necessarily born with these skills. And in those times of really high stress, sometimes we don't have all the skills we need to really come across in a way that we would like to be coming across. So how are we providing skill development and education so that we really can, on a consistent basis, continue to treat each other with kindness and dignity and respect and compassion and caring, even under pressure and in those stressful times? And there is education out there to really help people improve in those areas. Talking about personalization and finding out things that are important to me. If I'm the patient, how do you know what's important to me? Whether it's my healthcare goals or something as simple as when I like to eat my meals, when I like to eat breakfast, when I like to eat lunch, or if I'd like a snack. Or do you just have set meal times and then whatever tray is set in front of me is what I'm supposed to eat? How many of you have preferences and choices over food? And if you were the patient in the bed, would you just want a tray to appear and what's on it is what you get? Probably not. So are we affording choice to our patients and families? As far as we know frequently in healthcare organizations, there's a 5 a.m. blood draw and vital signs for all inpatients because it's really convenient for the nurses at that time, and then the doctors can have the results by rounds in the morning. But if it's not medically necessary, I don't know about you, but I would prefer to be sleeping at 5 a.m. And we know that sleep is really important to health and healing. And then when we also talk about, HCAP scores, for example, and the whole quiet at night, well, if you're waking me up all night long, I'm probably not going to give you some great scores on quiet at night, because it's not about the nurses having a party at the nurses station. It's because you've woken me up all night long. So again, how do we know? Again, we understand that if it's medically necessary, of course, and I'll understand that too if you explain it to me. But if it's not medically necessary, please don't wake me up just because it's convenient for you. You know, so again, how do we find these things out, and how do we help our patients, and how do we work together so that we can honor those preferences? Because when we do get the right information, we do work as true active partners together, we do become a really partnered healthcare team, and we are working together in the appropriate decision making. And the final driver is using evidence to drive improvement. We know that in healthcare we measure everything. We've got patient satisfaction surveys, we've got staff satisfaction surveys, we've got HCAHPS scores, we've got quality metrics all across the board. Every single department has their own KPIs or measurements or something. And you know, we could wallpaper the entire room here with all of the data and graphs. But are we measuring just to measure, or are we actually looking at the numbers and actually using those to continue to drive improvement? And that's really the key here. In your department meetings, you just hear that, you know, the patient satisfaction scores are down this quarter. And then, you know, we might have a little conversation about it, and then, you know, 2 quarters later, you know, we have another meeting, and it's like, yeah, you know, they still haven't improved. But if we actually drill down on what areas are really down, and what we might actually be able to address, and not the whole thing, it isn't like we're just going to improve patient satisfaction. There's a lot of elements there. And are we, like I said, drilling down and finding out, where did we miss the mark? Is this consistent in this area? Could we put together a work team that, you know, the people that work in that area, of, you know, some other departments that collaborate in that area, and have these people begin to talk to patients, get patients in the room and say, you know, we keep hearing this, what do you think it's all about? But again, getting those right voices together, really approaching, working on improving some of those numbers, because if we measure it, why not use those numbers to continually improve? Sorry. So then you've heard me say patient-centered care, person-centered care. What's the difference? You know the difference between patient-centered care and person-centered care? Or why I refer to it as that? So if I'm the patient in the bed, do I want to just be known as patient? I know I don't. How about, do I want to be known as the kidney stone in room 202? I work in a lot of healthcare organizations. There isn't anyone that I go to that hasn't at some point heard a diagnosis and a room number, because that's really, really common in healthcare. And if you were the patient in that bed, is that all you would want people to know about you, as the room you're in and the diagnosis you have? Because chances are, before you came in and were lying in that bed, there was a whole lot more about you than that. And when you go home, you would prefer to probably leave that behind and not be known as the kidney stone from room 202. So how do we change those conversations and move forward? How about some of you, even as far as your name, what you're called, is that the same name that's on your driver's license? A lot of times it's not. And what the name on your driver's license is sometimes the same name as what's on your armband. And you haven't gone by that name either ever or since you were 5 years old. And so everyone that comes in the room, they call you by the name on your armband, because that's all what's on your driver's license, and because nobody's taking the time to find out, what do you want to be called? So we know we don't want to be called by our diagnosis, but we certainly don't want to be called by the name we've never been called before. So how do we get everyone who comes in the room to know what I would prefer to be called? And even might our conversations that we're having among ourselves, whether you're part of the bedside healthcare team, or even the person cleaning my room, when we're having those conversations, might we have different conversations if you knew a little bit more about me? That I'm a wife, a mother, a gardener, a mountain climber, a fisherman, a musician, any of those things. Might we just have just a little different conversations if you just kind of knew who I was? And maybe some of that might play into what my care plan is, or my goals are for this healthcare episode, or any of those things, if we just knew a little more about who I was, other than my diagnosis. And the same thing with all of you. All of you work together every day, and many of you spend more time here than you even do at home, or at least an equivalent part. And wouldn't it be nice if you were known more than like that nursing hat you wear, or the housekeeper hat, or the maintenance hat, or whatever your job title is? Because that, you're so much more than that. And might we have different conversations if, you know, we knew that our kids were on the same soccer team, or that we both pulled fish out of the same lake last night, and wouldn't it be nice to be comparing those fish, or, you know, or any of those things, or we're both running in the marathon, you know, in Fargo next weekend, or any of those things kind of about each other. Might we just interact differently and have different conversations if we just really knew a little more about the people that we work with? So that's really more what person-centered care is just really looking at kind of the whole person beyond some of those labels that we have. Does that make sense? And like I said before, the evidence really points to that when you put all of that together, you know, you really do have better outcomes. You have a happier, healthier, productive work environment, and you really have true and active partnerships with your patients and family members. So any questions about that? Quiet group for a big group. recognize the essence of person-centered care. Just really knowing that everyone's going through something, everyone's got something. So at any point in time, if we could kind of see that bubble above someone's head, maybe it's something great, maybe it's something not so great. But just recognizing that we're all individuals and we're all humans and we all kind of are here to do our best, and really kind of being there for each other. So I want to thank you very much for spending this time with me today. And thank you so much for what you do for each other and for your patients every single day. Thank you so much.
Thank you.